Parenting is never easy, but when you have a child who is critically ill, or you're going through anxiety, depression, or, having some mental stress and anxiety, parenting becomes more difficult. And that journey takes on a new dimension emotionally, spiritually, practically, and otherwise. Today, we aim to create a safe, compassionate space to share experience, practical advice, and hope to parents. In this section of Navigating Parenthood, we're meeting two amazing, dynamic women who would hold our hands along as we go through the parenting journey. And I want parents out there to know that you are never alone. There's always help. All you need to know is to seek out, reach out. You have more support and help than you really know. If you don't reach out, you will never know what help you can get. There's a saying where I've come from that is a child that raises up their hands that they carry. Why is it so? If you don't cry out when you need help, no one can help you. We understand at times where we have people who don't help us, who want to reach out, but that should not stop you from reaching out. Today with me is Dr. Titilayo Kayode Alabi, and she'll be sharing with us on how to deal with children with critical illness. Again, on set again is Foluwa. I pronounce this name Olajolo, and I can call her Mo, who'll be talking to us about parenting and mental health. These two women are people who have diverse experience, and they're here to hold our hands. How are you, Titilayo? How are you, Mo? How are you doing today? How's your day been?
I'm well. Thank you.
Good. Thank good too.
Thank you. Thank you so much, Mo. I pronounced that name. I practiced and practiced. I don't know why now. Fifi Fuluwa. Now the name has come. Anyways, Dr. Titilayo, parenting in 2025 actually comes with a lot of challenges, not just 2025, all through the years that there's always been parenting. In your experience, what are the most common challenges that parents face when their child is critically ill? And how can healthcare teams better support them during those times?
Okay. Thank you very much for having me on your show. I celebrate you and what you are doing, because this is what we all need. The opportunity to know that we are loved, even if we don't know those people. So parenting a child with critical illness is as difficult as you can imagine. Already, like you said, parenting on its own is hard, especially in this world that we live in. But parenting a very sick child to the extent of you not even knowing what the end point would be is harder. So some of the things that parents may experience is a feeling of fear, the feeling of knowing what the future is going to be like, not knowing if that child is going to survive, not even knowing what the next minute is going to be. Because sometimes I've seen situations in the hospital where a relatively stable, sick child, in seconds, things change and that child is gone. Like that child is late. Even the doctors and the nurses are shocked at the way things suddenly deteriorated. So fear is one thing that parents may experience. And, fear is something that you may not even be able to share with others, but it is there. Then the other thing is that feeling of helplessness. They could just, especially in settings like Nigeria, where sometimes you may not even be carried along on what the situation is. Parents may feel helpless. They may, and then, of course, when they're even in government hospitals, the settings are not really the most encouraging or most supportive for parents. And that feeling of helplessness is there. You find parents on the corridors in the hospital, lying down on the corridors, looking, you can almost see, like, what's this going to, where is this leading us to? So that feeling is there. And then anger could go with guilt. So you find that in some situations, they may experience hunger, a lot of it, especially if they feel like somebody is responsible or something that someone did is responsible for the illness or a mistake. So you find them experiencing anger and sometimes guilt. And then lastly, shame. And
Yeah.
you may be surprised that why are you ashamed because your child is sick? But that is there. Um, Parents are unwilling to even share that my child is going through this. So if you are unwilling to share with someone, how then do you get help? And so how can I, as a medical doctor, as a pediatrician, what will I say? I will then say to parents that first you must show kindness to yourself. You must first
Do you
love
show
yourself.
kindness to yourself, Dr. Titilayo? First of all, you've already expressed the guilt. There's always that people, my son has an ailment, and people, first of all, will say it is your fault. How is that your fault? First of all, you have that, you're dealing with that blame on you first. So how can you say, how do I really express myself in that regards?
So thank you for asking. It may look like it's difficult. Like, how do you show kindness? How do
Mm,
you forgive? How do you accept without taking on responsibility?
mhm.
But we all know that that is difficult, but that is possible. It is
Okay.
forced by over and over looking at it in all angles. Okay, this child is sick now. Let's even say I made a mistake as a mother, or I heard some things, if that is it, or I was exposed to something, or probably a sickle cell disease patient. And the problem is that we as parents made a mistake, or maybe even my spouse deceived me into marriage. First, it has to start from the place of accepting that this has happened and we cannot reverse it, at least medically, right? We can't reverse it. We are dealing with this, but I can then say, as a mother, the only way I can help my child is by first loving myself and forgiving myself. Because in forgiving myself, I can own this situation. That's the only way I can be present. That's the only way I can help my child to the best of my ability. Because in the place of helplessness, of guilt, of anger, I'm even more helpless because those things paralyze us. It's like fear. They all come back with one emotion and one all wrapped up in one single thing, paralysis. It doesn't allow us to give in our best. So that's the first place I would say. And then I would then say every mother or father with a child with critical illness needs support. We need support from our churches, from our mosques. We need support even from the healthcare team. We need support from our family members, our friends. And I would always say, ask for support from those who you know love you, because you would find that people that even sometimes those that you think love you, they say the most mean things sometimes out of love, sometimes out of complete ignorance. They say very mean things, and you are left with feeling, I thought you loved me. But the place of vulnerability is key. And then as a healthcare provider, one thing I would always emphasize is empathy. As healthcare providers, you would find that a consultation time, because of the load of patients I have to see, is limited to maybe like 10, 15 minutes. So where is the time to be listening to one woman saying so many things? But I have found that mothers and parents with children that are sick, just being sick, not even critically ill, they need that, they need that support, knowing that their doctor listens to them. I found that it works all the time. Even when I do not say anything different, I've not said anything that will change the diagnosis. I've not given any new drug, the same thing, but they leave, sometimes even kneeling down as if you carried a whole load off their shoulders. So that time where we listen to them is key. Just listening to them without even offering help, without offering, oh, I understand, I've seen it before, I've experienced it, I've not experienced it, I've not seen it. You just talk, just say it, just say it. This is someone who is listening to you. That's really, really, really helps. And then encouraging them.
Thank you
You
so
wanted
much,
to.
Dr. Titilayo. Yeah, that's so amazing. Now, I want to ask more because, again, one, you're dealing with a child who is not that is critical ill. And apart from even a critical illness, parenting comes with so many challenges. So, what are the most significant mental health pressure parents face today, and how can they build resilience? You can build up on what Dr. Titilayo is talking about being critical ill, or just talk about parents, generally. How, there's so much pressure as a parent at this time. Well, we face it so much. How can we build resilience as parents?
All right, so thank you very much for this question, and such a very profound one, because parents are facing pressure here and there.
Everywhere.
That they will say pressure to quo, pressure to what. Okay, so well, significant mental health pressure that parents face today, I would say work-life imbalance, because everybody's now running in 9 to 5. You're doing intense business. Business is not as usual anymore. So there's that imbalance, yes, and it in the form of pressure to parents, because especially in urban city where there's a lot of traffic, there's a lot of meeting ups to do. You come to realize that parents even get to leave the house very early in the morning and come back very late. So all of those things to contribute to the pressure that parents face. So another one would be the economic stress. We cannot deny the fact that things are getting hard currently in the world. The prices of things are above the roof. And as parents, generally, they want to care for their children. They want to ensure that their children are living the best life. So that also contributes, is a form of pressure that they face. And I would also say that digital overload and social media pressure, because now everybody's putting their children on social media, and there's that form of comparison. Oh, see this person's child, see my own child, this person is 5, this person's child is 5, my own child is 5, and my child does not even have half of the ability of this child. So we are we're constantly we're constantly comparing ourselves to strangers, people we do not know. Gone are the days where people compare themselves with people that they can see in their neighborhood and all of that. But now we're comparing ourselves to millions and millions of people that we do not even know on social media. So those are some of the mental pressures that parents face now. So, but I would like to touch on mental health issues that parents can experience. So parents can experience anxiety, they can experience depressive symptoms, they can experience depressive symptoms that comes from being stressed over time.
Mm.
So yeah, so they can experience all of that. They can experience post-traumatic stress disorder. Actually, children of that have parents that have children that are ill, or they are sick, critically ill, they can experience PTSD, where they are constantly reliving those past experiences, and it's giving them fear and trauma. So I would say, how do we build resilience in this world where there's pressure every now and then? Number one, you need to set boundaries. As parents, setting boundaries is a whole lot, and it could be a lot for us, because parents don't know how to set that boundaries between them and their children. You just expect that
Mhm.
whatever your children does to you, whatever your child does to you, you have to accept it, you have to embrace it and all of that. But as parent, I tell you that you need to set boundaries, because if you don't, and if you don't take care of yourself, you're going to affect your children. So you need to set boundaries. You need your children to know that this is mommy's time, and mommy's time remains mommy's time. Growing up, I would remember my mom would say, "Look, we are be mama meaning go and call the person that gave birth, but does not have mouth to eat. So what she's saying is that as I'm taking care of you, I need to take care of myself. So we need to set boundaries around that. So we need to also practice self-compassion. As a parent, I know that there are a lot of guilt here and there, mommy guilt, daddy guilt, but you're doing well. You're doing just fine. And sometimes people tell me that, oh, I need to talk to this parent. She's lackadaisical, she's not doing that. And when I'm meeting with the parent, and I'm like, mommy, you're just doing fine. Daddy, you're doing fine. Because the pressure can be a lot, and people are not even seeing that work. They're not seeing that I am trying to be the best I can. And before you address somebody's weakness, you need to talk about their strength and help them to see how well they're doing before you help them to see what best or how best they can do what they're doing. Another thing is prioritize rest a lot. As a parent, please don't joke with your rest. Don't joke with your self-care. And as Dr. Titi had said, don't joke with getting support.
Yeah.
We cannot do it all by ourselves. And I'm wondering why, community support is something that is getting missing these days. I understand the insecurity around all of that, but we need to find our own tribe. We need to find our support system. All right. Yeah. So I'll just stop there.
All right, thank you so much, Mo, for that. What you just explained is actually very profound. Now, Dr. Titi, a lot of times when parents who have children who are ill to go to the hospital, how do they overcome, or they become overwhelmed? Parents become overwhelmed by medical jargons and decisions. Sometimes you are not telling us what we need to hear. The more you talk to us, the more overwhelmed we become with the many things and the many things, the many medical things we always talk about. How can we simplify the lives of these parents? How can parents care for their own mental health as they're supporting their children? And how can they really understand medically how to support their kids? Not everyone is a medical doctor. Not everyone is schooled. Not everyone understands the many things we're being told or the overload of information. How can we as parents really support our child who's not feeling well based off all the many things that doctors say to us?
Thank you for that. Okay, so I remember that even for me, when my mom was ill, even as a medical doctor, specialization actually removes that general knowledge. Not completely. I have general knowledge, but because I am a pediatrician, when I don't necessarily have everything it takes to care for an adult, especially when you now start talking about different diseases. And one of the things I was really key, that I really wanted was that communication. So first, as medical doctors, it's almost something that sometimes is missing, but clear, compassionate communication, simplified. Sometimes when I have to explain to parents, what I do is I even draw. Thank God for me, I am a creative. I write stories. So I like to simplify. So I bring out a paper, I write stories. If I don't have a paper, I make I give examples. So I'm saying, imagine if this hole is supposed to be clear and cars are supposed to be able to pass these holes, and then there are bombs, and then there are potholes and different things. What do you think would happen when different cars want to pass at the same time? So something like that, probably using to describe atherosclerotic plaques. So I'm trying to explain in clear, simple languages that can involve so many things. The other thing is, like I said, just giving parents time. That time I know it's not doctor's fault. Giving them the time to be able to ask questions, because you know, in the place of them asking questions, then you can respond, and then you can even see that, because let's say, for example, a parent was on admission in the neonatal ward, the child was a preterm. I know that, of course, preterms may say they are not critically ill, but they are like one of the most delicate
Yes.
to care. So they go home and they come to my clinic on Tuesdays. That clinic runs on Tuesdays, in neonatology clinic. I'm like, oh, how are you feeding? I find that they are not doing what they were taught. And then I go back to the ward and I'm like, you people did not say, you didn't teach this mother how to. And then like, doctor, for 3 weeks, transitioning to home care, this is what we emphasize for that mother. So you realize, not that she did not hear, she just didn't get it all. So
Yeah.
what do? I start all over, show them this is it. Oh yeah, you do it. And then I give a short appointment. Come back to me next week. 7 days, go and practice. Of course, the weight gain will show us whether you got it or not. And then ask them to come with a family member, preferably their husband. The next thing I will then do is asking parents to read online. I do that a lot. So I've explained to you. I'll then
Dr. Titi, some doctors don't like it when you read and come back and tell them, I read this. They get upset.
well, that's a different scenario.
Yeah, I know.
That's a different scenario, because you've gone to read online and you're coming to educate me. It's different from, I'm trying to explain Down syndrome. Of course, you know, for example, I can't tell everybody to read online.
Mm.
Do you understand? Some parents are not even literate. Like in the setting where I work now, is a suburban setting, and some of them can't read. But for those who can and who have access to smartphones, I ask them, this is based on what I have explained to you. Go check and read about it. Or at your next appointment, we are going to talk about it. Or at my next ward round, which I run like 2 or 3 times in a week, I'll then say, at my next word round, what you've read, we would then ask me questions, what you do not understand. These are things that I think a basic understanding of an illness first gives parents control. It gives them power, because we know that knowledge empowers. I feel like those are the things I would say at this point.
All right, thank you so much, Dr. Titila. That was very, very, very explanatory. It's just actually simple and down to earth. I love the way you use simple illustrations to make these things very easy. So I want to also find out from you more. How does a parent's mental health affect their child's emotional well-being? And what steps can families take to foster open conversations about mental health at home?
Okay, all right. So thank you for that question. Research has gone ahead to show us that parents' mental health affects their children's emotional well-being. Yes, because if you as a parent, you're not mentally stable, you're not mentally fine, you're going to transfer aggression, your ability to care for your child holistically would be reduced. Do you understand? So, you know, even as parents, there sometimes probably do not sleep well, you're stressed. You're going to take it out on your children. You're going to lash out. You're going to talk to them anyhow. It can affect their self-esteem, affect their academic performance. All right. So it can affect how they see themselves if you constantly put them on the edge because you are stressed, because you are depressed, or because you have anxiety. You are constantly, you know, just pointing out how you feel and your own mental health state on your child. So your children they mirror your emotional state, they mirror your behavior, they mirror everything that you do. So if you tend to be constantly anxious, or you're withdrawn, or you're constantly stressed, you see it in your child. All right. So how we can foster open conversations about mental health is that normalize talking about emotions. Yes, and I don't know why. Like, I think that we need to do better with that, because you're a parent, you're not a superman, you're not a superwoman, you're not, you don't know it all, and all of that. So you need to normalize emotions. Normalize to tell your child that mom is not feeling happy at the moment, and mommy will talk to you later. And also tell your child, like, talk about emotions with your child. Oh, he is feeling sad currently. Oh, I'm just going to give him a few minutes to just get over it. Does he want to do deep breathing with me so that if he is feeling angry currently and frustrated? So can we do deep breathing? Can we do deep breath, and maybe you will feel better? Do you want us to count from 1 to 10? Do you want us to do some some breathing exercises that makes you feel less frustrated and less angry? So we need to learn to normalize emotions. Number 2, create safe space for your child to be able to have conversations and for them to be able to express themselves. So if you use what they told you yesterday against them today, they would most likely not want to talk to you about it, because children can be very sensitive. So don't come and because they told you, mommy, I was angry with a child yesterday because he did this, he did that. It's not be next year. African parents do that a lot. Next year, they will remind you about what you did and how you felt. Do you understand? So you don't use their own conversations against them. Ensure to create safe space for expression, and talk about it, read stories, and engage active listening. Don't brush off your child's emotion. Listen, offer your own advice, and give them suggestions on how they can and do things better. So I believe that with all of this, you'll be able to foster open conversations.
I'm even feeling better right now as you're speaking to me, talking about normalizing emotions. I just feel like, my emotion. I felt this morning I was so angry. Why are you not doing this now? Normalize it. It is okay to feel not okay.
Yeah.
Now, Dr. Titi, as we begin to round this section, how can parents balance the demands of complex home care with their own well-being and family life, dealing with a child who is not feeling well? Because for me, I've come to realize there's no such thing as work-life balance. Taking care of the children life balance does not exist. It will always be lopsided. So how can parents find some sort of, balance in the imbalance, especially with the demands of a complex home care, dealing with a child who is critically ill, their own well-being, and family life?
um getting that balance may first be difficult, so they need to understand that. So first, parents need to see that it is a journey that they are on. It is not a sprint. Like, it's something that they take one step, simple step at a time. So they're not going to just get there suddenly, oh, I've arrived. They are going to go from one step to the other, getting little wins by time, and probably failing at other times. But they need to understand that when they fail, they do not blame themselves and stay there. They then look at that, okay, what did I do wrong? I think that is just a summary of everything I was saying. So setting realistic expectations for themselves and avoiding comparison. The world that we live in now fosters a lot of comparisons. You find parents, people online, making it look like as if their life is the most perfect. But probably that is not even true. Maybe it is true. And that's fine. That's fine. I don't necessarily have to be perfect like you. I don't have to have it all in control, but I need to be able to see myself where I am now and see that it is a journey that I am on. And then also for parents, in order to be able to achieve this balance, they need to be able to take some breaks. Take breaks from the whole hustling and bustling of life. Take breaks even from taking care of your child. It is not a it is not something you should feel guilty of. You should be able to say, I feel really overwhelmed at this moment, and I'm going to go home for a day without coming to the hospital. I'm going to go to church and just have a retreat for that day without coming to the hospital, probably spending time in prayer, spending time in reading the Bible, or just spending time sleeping. Because when I get that good sleep, I can then come back and be the best mom for a critically ill child or for any sick child. Then the other thing would then be that they should be able to ask for help. I will still go back to that. And in asking for help, they need to be able to show some vulnerability. This is where I am on this journey. It's been a difficult one, and it's not been easy on me. They should be able to ask for help from their friends. Oh, would you be here between 9 and 12? The doctors will be on ward round. At that time, I'm usually alone, and I'm so usually overwhelmed with thoughts of what is going to happen to my child. And then you'll just have a friend who comes, not saying anything, not giving you any form of support with their words, just there holding your hands. Just holding your hand, and you're there looking at each other, allowing yourself to be able to cry if you have to. That's asking for help. And then sometimes just delegating. They don't have to be responsible for everything. I want to turn the child. I want to clean up the child. I want to change the diaper. I want to lift the head up. I want to go to the pharmacist to buy drugs. I want to do this. I want to do everything by myself. That is going to drain them. So being able to ask for help, even spiritual help from pastors, and asking them to be able to, come to the hospital, pray for them, pray with them, and pray for them without even necessarily coming to the hospital. And then at home, it is then also important that they should prioritize simple things that helps them to care for themselves, and also that helps them to care for their children that are sick. For example, for me, one simple routine would then be that time where I'm reading the Bible. It may seem like, how is that even helpful? But I found that in just sitting down, 30 minutes, and it looks like 30 minutes is supposed to be a long time, and I'm just there with one chapter that is 12 verses, but one word or one sentence has caught my attention, and I'm sitting down with that. Just that time of, or sometimes meditation, just sitting down and meditating. But in meditating, we are not then thinking, oh, is my child going to die? But we are then thinking, we are then emphasizing or reiterating things that we believe that is good. Or it may just be sleep, 15 minutes of sleep, 10 minutes of sleep. And for some people, it may just be that time where they go for either a massage, go for either a pedicure. It could just be anything. It could just be a phone call conversation. You'd be surprised that just having someone to talk to may just help. So this helps parents to be able to balance. And that balance sometimes means not being completely involved, but being able to withdraw. And withdrawing, not knowing that you are not neglecting your responsibility, but withdrawing, knowing that by doing that, you are recharging and then being able to be present for that child.
Wow, Dr. Titilayo, that is so awesome. As you're speaking, it just drops in my spirit. There's so many things that we can actually do as parents to keep it simple. There are things that we can actually do to help ourselves in this journey. Because again, it's not an easy journey, but we can also be good to ourselves. Now to Mo, final question to you is, how can we find that space? You gave a quote about what your mom used to say. How can we find that space for ourselves mentally and not feel guilty? A lot of times, parents feel guilty when they need to create that time and space for themselves because there's always so much to do. And sometimes we feel overwhelmed, sometimes we feel not good enough because of that. So, more, how can we create a space and how can we stop beating ourselves and really take care of our mental health and ensure that we not just survive or just exist, but really live to be or to become our full self and live to our full potentials?
All right. So thank you for that question. I think I will answer the second one first, then you would remind me of the first question. Okay, so my mentor would say something that there comes a time in the life of your children that they don't just need a mother, they need more than a mother. And if you do not take time to invest in your own self, care for yourself, whenever they need that more than a mother, they might need an intercessor, they might need somebody to reference in the future. They might need a mentor, they might need an author in a mom, they might need, you know, a doctor grade degree holder in a mom. So that, you know, they're not just seeing a mom, but they are seeing a PhD holder, they are seeing a UNICEF consultant, they are seeing so much more in one person, and it gives them that encouragement. So this is saying to parents that I know that you want to care for your children. I know that you want to be all of that for your children, but if you don't take time to care for yourself, you are not going to be there when your children need you the most. Yeah. So I put out a content sometimes ago, you know, and I was just reading comments, and somebody said that, okay, it was about self-care strategies for parents of children with special needs. And somebody said, oh, that he wished his childhood friend took care of herself, and while she was taking care of that child with special needs. Both of them are late now, both the child and the mom. And, you know, it was a very sad story, because I'm just like, you were taking care of this person without investing in your own self. So parents, you know that it's okay once in a while to be selfish. It's okay to care for yourself, so that you're not pouring from an empty cup. Like there's even nothing to pour from the empty cup. Yeah. So don't be drained. Care for yourself. Take care of yourself, so that when your children need a grandmom, right, to come and do omugo, you are still very much alive, ill and hearty. When your children need someone to sign reference form, guarantors form, when they're about to do big things, you are there. So don't limit yourself. Take care of yourself, and so that in the future, when your children need you for multiple purpose, you are there. So can you remind me for the first question?
The first one you practically also answered it. The first question was,
Okay.
how do parents create a space for themselves and not feel guilty? How do they begin to mentally take care of themselves to know that it's okay not to be okay, and it's okay to demand a space, me time? I started by your mother's quotes. That's what I started with. Yes. So if you can
Yes.
just a little bit of, you spoke about it, but just throw more light on
Okay.
that.
All right. So usually I would tell my mom jokes, because she makes a lot of jokes and she says a lot around this. And she was like, she's not going to die yet, because she doesn't want us to come and put flowers on her graveyard and say, Mommy, we miss you. Like, we're going to enjoy this life together. So I am telling parents that you need to enjoy this life alongside with your children. So take care of yourself. Be intentional about it. Be intentional about it, because you don't want your children to be parentless. You don't want your children to be without a mentor, a guardian. So you need to be intentional about it. So have that mindset of, I'm growing, my child is also growing. Have the mindset of, I want to be there when my child is doing great things, so that we can be doing great things together. I think that parents just think that, oh, once my child is doing great things, that's all. You can be doing great things and your child can be doing great things side by side. I mean, the sky is big enough for everybody to fly, and for us to all be great at the same time. So you can be up there, and your child too can be up there, and so I want you to have that mindset of, I'm growing, my child is growing. I am going to be greater. My child is going to be greater alongside with me. I need to care for myself, so that when my child needs me to pull them up, I'm going to be there to help them.
Amazing. Well, thank you so much. So, Dr. Titilayo, please, final words as we bring this section to a close, dealing with children, parenting children with critical illness. How would you say to the parents a kind word, encouraging word for them at this time? You're muted.
Thank you so much for this interview or this session. I just want to say first and foremost that remember that you are not alone and that you are not without help. You are not without help. You have people all around you. It took me some time to recognize that there are people that love me all around me. It may look like the world is busy and you don't receive phone calls, or maybe you don't have so many friends, but you'll find that even when they are not reaching out to you, people are literally, they have you in their minds or on their minds, and they're really probably praying for you, thinking about you, and wishing that things were good for you. Also remember that you are not responsible for how things turn out. Even if you contributed to some things, you are not going to be responsible. You are not able to be present if you do not show yourself love, if you do not forgive yourself. And remember to ask for help. There are people that are experiencing similar things around you, so ask for help. But speaking just briefly to what Finfolua was saying, take care of yourself. I remember my mom. She died at 67. I know that woman could have lived longer. That woman is the strongest human I've ever seen in my whole life. And she's one of the reasons why I do some of the things I do online, talking about health. My mom, probably, I don't know if it was ignorance, she didn't take too much care. I'm not saying that she was careless, but she could have done better dealing with hypertension and diabetes. Looking back now, with the knowledge I have now, I'm like, oh, maybe if we knew this, or maybe if she took the steps, things could have been. Please take care of yourself. Right now, yesterday, I woke up in the morning and she came to my mind, and I just missed her and wished she was alive. She probably would have been 71 or 72 now. Just wishing that I could speak with her. You take care of yourself so that by the time your children want someone to gist with, you are there. You are healthy. You are doing things. You are alive. So take care of yourself. In one of my books, Live, though it is for expectant moms, I wrote live. Just live, and don't carry about the burden of what you are going through. Life is not necessarily perfect, but you can create your perfection in the midst of it. So I hope that this helps you. And I really want to thank Mrs. Eruke for this brilliant initiative. God bless you. Thank you for looking out for others. Thank you so much.
Thank you, Dr. Titi. Mo, yes, just a few words to just wrap this up, because as I listen to Titi speak about her mom, there's so many parents out there that we need to speak to. But let Mo say her words.
Okay, so my final words would be that, like I've said earlier, parents, you are almost everything your children have. So it is important that you care for yourself so that when they need you, you are there. And kindly normalize talking about emotions. Don't be the superwoman, the macho man who never talks about how they feel, how they're feeling anxious about a particular exam and all of that. Parents, when they're having exams, they don't even talk to the children that they also feel anxious. So normalize talking about all these things so that your children can know that it's okay to experience these emotions, it's okay to feel these emotions. So I would wrap up with that. And daddy, mommy, aunties, uncles, you are doing just fine.
Oh, with this, I want to say thank you, Dr. Titi. Thank you, Mo, because, parenting a critically ill child is a journey that no one chooses. But like Dr. Titi said, there is support for you. And you can find that strength and you can find wisdom, and there's hope for you. All you need to do is really to raise your hand. Mo said something that I want all of us to take very seriously. Self-care. Take care of yourself mentally. It is important. If you're not mentally stable, you're always anxious, you won't do a great parenting job. Your children need you. We need our parents. Our children needs us. The society needs us. So I want to say, leave your comments, reach out to these people, an amazing set of people who will give you great suggestions and encouragement in our journey of life. And remember, you are never alone. Parenting is a journey and it takes a community to raise a child. Thank you everyone for being a part of this today. We'll see you in the next section. My name is Coach Eruke and parenting is a beautiful journey. Thank you.